Hello everyone. This report is as of 9 a.m. yesterday, the 4th of November, when there were 2,557 people positive for SARS-CoV-2 across the islands. You'll be aware that a number of people are positive on the sister islands, but I'm pleased to say these people remain stable, either asymptomatic or with minor symptoms being managed under observation at home. There is still the one person who was transferred from Cayman Brac to Grand Cayman to the Georgetown Hospital, and this person is stable in hospital. There were 75 additional community cases and no additional cases related to travel yesterday. Of the 10 admissions, I think it's important for me to let you know that 8 of these are unvaccinated, and the 2 that were vaccinated have additional medical conditions, and we are aware that medical conditions do predispose you to the effects of COVID disease, unfortunately. You'll also know that the lateral flow policy, the National Lateral Flow Policy, has been published and is in effect. There is a separate policy for government entities, and core government has also issued its own policy, and this is being rolled out as we speak. The availability of lateral flow tests is improving almost on a daily basis, so every day I'm hearing reports of tens of thousands of more tests arriving to be deployed for the various organizations across the islands. There's quite a bit of information available on exploregov.ky/LFT-policy. On there, not only will you find the National Lateral Flow Policy, but you'll also find a lot of infographics and other information to describe how you might use the policy to enable either yourself or your organization manage through this particular part of the outbreak of COVID disease. In essence and in very brief, what we hope to do is to enable people to keep going, keep their businesses going, keep going to school, and you can do this even if there is somebody that is positive through a lateral flow test or through a PCR test in your household if you're fully vaccinated or if you're a child attending school. In those circumstances, provided you agree to undertake daily lateral flow tests, then you'll be able to continue with your activities provided on those daily tests you remain negative. If, however, you're unvaccinated, you would need to remain isolated in the household for the 14 days as was previously. Anybody that is positive needs to have a negative PCR test on exit from their quarantine period. If you are testing yourself with a lateral flow test, please can I remind you that by law it is a requirement for you to report that test either yourself or on behalf of any children, and you can do that as well on the government's website, explore.gov.ky/report-COVID-19-result, or call the flu hotline and let them know and they will pass on the information. I know this continues to be a worrying time for everybody, but for my own part, I am reassured that the numbers in hospital are remaining relatively low. I think this is an enormous testament to the numbers of you who have come forward for vaccination. It is proving to be protective, and I would encourage anybody that's left to be vaccinated, please do come forward. And if you're in an eligible group to receive the booster dose, also please come forward. As of next week, not only can anyone over the age of 50 and anyone who is in a clinically highly susceptible group get their booster jab, but also people who are working for certain frontline staff, and please do look at the hsa.ky website for information about who is eligible. The week after that, so in roughly 10 days' time, the booster dose will also be extended to those over 40, so please keep an eye out for that, and do come along for the boosters, which we know will give you increased protection following on 6 months after your second shot of the Pfizer-BioNTech or AstraZeneca jab. Thank you.